ISUOG basic training programs. Okay, ISUOG basic training programs for the mid trimester ultrasound scan. So basically there will be a 20 plus 2 approach to the routine mid trimester scan in the as per ISUOG training programs. The basic learning objective, how to perform the structures routine examination including measurement and the mid trimester fetus using the there will be a 2 overview of a scan and 20 planes approach. So 20 plus 2, you have to remember this point is 20 plus 2 approach. Okay, so basically what are the rationale behind, what are the 20 plus planes, what are the plane related to the ISUOG basic training recommendations. We'll discuss all these things. So basically the rationale behind this all this 20 plus approach is to provide a structured and logical method of examinations, structured and logical method of examining the mid trimester fetus by performing by anatomical review with the anatomical planes from which we obtain fetal biometry. That also has the potential to, we have to basically, this approach is held to exclude all the 50 abnormals, congenital abnormalities. Okay, so basically you have to do BPD, head circumference, abdominal circumference and femoral length. What are these 20 plus 2 planes? A combinations of 2 overview sweeps and 20 planes of the fetus. Each plane relate to a specific fetal sections or view. Actually each plane has a separate fetal sections or view, and you have to take a specific measurement, and each plane has a number of structures to be evaluated, and criteria for referrals are also included. The combination that enable the potentially, you have to, after using this 20 plus 2 planes, you have to exclude all 50 abnormal fetal appearance abnormality in the fetus. So basically our aim is to exclude all 50 abnormality fetal anomalies in the baby. So basically there is ISUOG's 3 practice guidelines. One is on the sonographic screening examination of the fetal heart, one is fetal neurosonogram, one is fetal trimester screening, and the basic training program. So first you will discuss this ISUOG basic training recommendation. After that we will discuss the mid trimester scan, then fetal neurosonography and cardiac sonography. So in the basic training, the 20 plus 2 planes, basically very important 20 plus 2 plane. First is the 20 is the planes and 2 is the 2 overview, that is the sweep 1 and sweep 2. There will be a anatomical landmarks, is total 9 anatomical landmarks and 20 planes and 2 overview. In the sweep 1 has to be done. You have to, in this sweep 1, you have to do longitudinal, you have to see the head and body for initial orientation of the fetus, whether fetus lie in the longitudinal lie or it is a transverse lie, whether presentation is cephalic or whether presentation is bridge presentation or any other presentations. So the first plane is your spine anatomical area. So total 9 anatomicals area. Okay, 9 anatomicals area and 20 planes. So first anatomical area is the spine. So in the spine there will be a 3 planes, plane 1, plane 2, plane 3. In the plane 1 is in the spine, you have to go a sagittal complete spine with skin covering, because you have to see the skin, whether the skin is covered or not, to rule out all the meningocele, myelocele, metamyelocele, all these neural tube defect. Okay, then second plane 2 is coronal complete spine. Then you have to do a coronal sections, and after that coronal sections, plane 3 is coronal section of the body of the spine. You have to see the spinal vertebra and the laminar process of the spine. Okay, then in the second anatomical area is your head. In your head there will be another again 3 planes, plane 4, plane 5 and plane 6. Again they have divided. Plane 4 is called as transventricular planes, and plane 5 is transthalamic plane, and plane 6 is your transcerebellar plane. Okay, the third anatomical area is your thorax, and in the thorax there will be 4 planes, and in this 7, 8, 9, 10 plane 7 is your lungs. You have to see the lungs and all 4 chambers view of the hearts. And in the 8th plane, number 8 is left ventricular outflow tracts, and the plane number 9 is your right ventricular outflow tracts and the crossover of left ventricular outflow tract. The last is plane number 10 in the thorax part is your 3 vessel trachea view of the heart. Okay, next is your next anatomical planes. The 4th anatomical plane is the abdomens. In the abdomen there will be a 3 planes, 11 plane 12 plane 13. In the plane 11s there will be a transverse sections of the abdomen with the stomach and umbilical vein has to be there. In the plane 12, the transverse section of the abdomen, and at the level of cord insertions, you will take a plane. Then plane 13 is the transverse section of the left kidney and the pelvis, and the right kidney and the pelvis. Okay, so basically this plane abdomen is 11, 12, 13, and plane 14 is your then the next anatomical, your the fifth anatomical area is your pelvis. In the pelvis, the anatomical plane is 14. That as descriptions is where to look the transverse sections of the pelvis. You have to see the pelvis, you have to see the bladder, and both the umbilical artery has to be visualized in this plane. The seventh plane, that is 8 planes. Seventh plane is your limbs, 15, 16, 17. Femur, diaphysis length, and 3 bone of both legs, like both feet, 3 bones like your femurs and tibia and fibula, and both feet and normal relations to both legs, and limbs, 3 bones. So in the thorax there will be a 4 planes, that is 7, 8, 9, 10. That long 4 chamber view, left ventricular outflow tracts, right ventricular outflow tracts, cross of 3 vessel trachea. Limbs and the face. In the face is the very important. Unless you see the face, you can't see comment anything. 18, 19, 20 number planes. In 18 is coronal view of you have to see the upper lip, nose, nostrils, and 19 both orbit and both lens, and the 20 is the median facial profile. In the second, after this all these planes, 20 planes, you have to go for overview of the second sweep. That is the transverse sweep of the, you have to starting from the body, from the neck to sacrum, one vertebra at a time. See, so basically these are the sections. This is the transventricular plane, this is the transthalamic planes, okay, transcerebellar plane, and this is your pochambus view, and this is your abdominal at the level of umbilicus. This is the femoral length, this is the all 3 bones, and the lower limbs, this is the upper limbs, this is the lower limbs, and this is the umbilical placental insertions, umbilical cord insertions. This is the abdominal at the level of pelvis. This is the bladder, okay, this is your bladder, and this is your upper lip, this is your mouth, this is the orbital lens. These are the sections you can see, and in the next sections. So what are the abnormalities should be excluded? The key to the 20 plus 2 planes approach is understanding the importance of knowing what is the normal ultrasound appearance in each plane. First you have to see the normal things, then you exclude. After that you can get the abnormal thing. The knowledge, you get the exclusion of a range of abnormal appearance or abnormality rather than making a diagnosis. The range of abnormal appearance being sought may be differ depending on the local service requirement. So sweep 1 is, I told sweep 1 is longitudinal view of the body for initial orientation. You have to see the fetal heart and skull, and the sagittal complete spine with skin covering. In the plane 1 is to structure to be evaluated here is to 2 ossification center of each vertebra T1 to S5, skin covering has to look for. In the plane the sweep, the second is plane 4 is transventricular planes. You have to see the skull size, safe integrity of bone density, midline facts, cavum, septum, pellucidum, frontal, anterior horns of both lateral ventricles, posterior horn and lower lateral ventricles. Okay, and you have to see the posterior horn, if posterior horn is more than 10 mm, that is the ventricular megaly. In the thorax, longs 4 chamber view of the cardiac situs inversus, left right longs 4 chamber view has to look for. Where is the uterus in the sweep 1, you have to check for the switch longitudinal head and orientation, presentation of the fetus. Moving through 20 planes, first plane 1 starting from the coronal sagittal complete spine with skin covering, then plane 1, the plane 2 is coronal complete slightly angled probe through 90 degree, you get coronal section complete plane. Then transventricular plane starting from the plane 1, this plane 1 just rotate 90 degree, plane from spine, the vertical spine to rotate 90 degree to get a plane 2 to 4, and then go 4 to 5, just rotate slide minimally, you get 4, 5, 6 plane. Then for plane 7, 8, 9, 10, from spine you have to go rotate 90 degree, then you get right. If you get 7 to 8, you got a right to rotate towards right shoulder to get plane 7 to 8 side towards head, 7 to 9 and 9 to 10 side towards heads. Moving then 11 to 14 plane, that is your pelvis plane, transversal abdomen stomach plane, starting from plane 10 1 you can rotate 90 degree, then from plane 10 to 11 slide minimal rotation has to needed. Then 15 to 17 just slide rotations has to required from 14 to 15. Okay, from the abdominal plane you have to go from 14 to 15, then 15 to 16, then 14 to 6 slide rotations angulations. Okay, Then you can see the coronal view, transventricular planes, 18, 19, 20 view upper planes. Then you start from the transventricular plane. Here you start from the transventricular plane. Then you just move 90 degree, rotate 45 to 70 degree to get a 18 planes. Then rotate minimally, accept the posterior slide angle from 90 degree, get a median facial plane. So when performed correctly, if you correctly done a 20 plus 2 approach, 20 plus 2 approach has the potential to exclude 50 abnormal fetal appearance, which 20 plus intrauterine deaths should be excluded. The total is 50. So in the sweep one, you have to see the abnormal appearance of the fetus, and IUD can diagnose 1 to 3 planes, 10 and 4 to 6 head. Number of totals is 50. So what are the abnormalities you can exclude in the 22 plus approach plus IUD? First is sweep 1. You can see the anencephaly and the intrauterine death can be excluded in the first sweep, that is the fetal anencephaly, fetal skull. In the spine, the second 1 to 3 planes, abnormal abdominal situs, left sided spine abdominal situs, left side diaphragmatic hernia, meningocele, open spina bifida, sacral agenesis, sacrococcygeal teratoma, because these are the things in the spinal plane. In the spine you can see this, all these meningocele, spina bifida, sacral agenesis, sacrococcygeal teratoma, because your section will be cut through the spine and it can be transverse sections, and the sagittal, coronal, and the section through the body of the vertebra. So we have to rule out all these things. In the section sweep, that is the plane number 4 to 6, that is the head. You can see the A lower hollow transventricular transthalamic plane and the transcerebellar plane. All over hollow presencephaly, banana shaped cerebellum, cystic hygroma, large posterior fossa cyst, lemon shaped skull, and occipital encephalocele, skin edema, ventriculomegaly. These are the things can excluded in the second plane, that is the 4 to 6 plane, that is the second anatomical area, that is your head. So first is your spine, then is your head, then is your third anatomical area is your thorax. 7 to 10 you can see atrioventricular septal defect, CPAM, double aortic arch, ectopic cordis, overriding aorta, persistent left vena cava and right aortic arch, severe aortic stenosis, coarctation, pulmonary stenosis, significant pericardial effusion more than 4 mm, pleural effusions more than 4 mm, any cytos inversus, ambiguous and tetralogy transversion of univentricular heart, and ventricular septal defect moderate and large. These are the things you have to exclude. Very, very important. This thorax part is maximum number 16, around 16 congenital anomaly can be rolled out in this thorax. This is the most important plane, that is almost 16 anomaly can be rolled out in this plane, that is 7 to 10, that is the thorax. So spine, heart, head, and thorax. Okay, then 11 to 13 planes is your abdomen. You can see the ascites, bilateral renal agenesis, duodenal atresis, ecosonic bile, gastrochasis, omphalocele, renal pelvic dilatations, that is more than 7 mm of APPD diameter, small or absent stomach. These are the things can be excluded in your 11 to 13 planes, that is your abdominal planes. Okay, spine, head, thorax, abdomen. Then the 14 number plane is a pelvis. You can see citirenal dysplasia, lower urinary tract obstruction, 2 basal cord. This is the 14 number pelvis planes. 15 to 17 is your limbs, that is flexion, deformities, wrist, several skeletal dysplasia, talipos, and varus. 18 to 20 face deformity, anophthalmia, cataract, cleft lip, trophosis, and severe micron. These are the things can be excluded. So any appearance which is not normals, 1 to 3 spine, head, thorax, and abdomen. 11 to 13, pelvis is 14, limbs, face. So atrium laterally more than 10 mm, BPD heads outside normal range size of heart. Abdomen, you should the outside abdominal circumference outside the normal range of size of chart, then you can go per, and one or both renal pelvis more than 7 mm, the APPD diameters. These are the lateral ventricle more than 10 mm. This is the reference range of 7 mm is the APPD diameter for renal pelvis to dilated renal pelvis, limbs, fetal outside the range of normal size of. So key points working through the 2 overview planes and 20 planes that describe the sequence of provide logical and time efficient examination of the whole fetus. Examining the fetal anatomy correctly more important than the order in which it assess. Your role to distinguish between the range of normal and abnormal appearance of the mid-trimester fetus. Any appearance which cannot be confirmed as normal should refer to more experienced opinions. Thank you. If you like, please subscribe. Thank you.